Healthcare workers have sworn to continue with the strike for as long as possible until the government addresses their demands. According to the workers' unions, Health Cabinet Secretary Mutahi Kagwe has been painting a false picture of what is ailing the sector. Today marks day 17 of the nurses and clinical officers strike and the third day for the doctors. Raquel Mugai has more details.
Not be slaves in this country. We have put forth demands that must be addressed.
We are being told we are dispensable. That's when we die, we can fall between the statistics.
They are words driven by anger following Health Cabinet Secretary Mutahi Kagwe's remarks on Tuesday.
The Council of Governors has confirmed that all counties have designated specific health facilities to treat all counties, to treat all workers, all health workers and their dependents.
Doctors, nurses have died while trying to be transferred from one county to the next, from Meru to Nairobi, from Isiolo to Nairobi. And you're telling us that you're being unreasonable.
That bearing some truth in it, considering the state of some of the said isolation centres. This building, located at the Kenyatta National Referral Hospital, was set aside for that purpose, 140 million shillings being poured into it to ensure 200 beds were installed. However, the situation inside is far away from that. Our sources indicating that KNH administration ordered its closure in September.
Our conscience is very clear when we're engaging in this industrial action.
The only healthcare workers that have gone on strike during a pandemic situation are the Kenyan healthcare workers.
9 September 2020, Zimbabwe biggest nurses union ended a strike that had lasted 3 months.
Additionally, South Africa, Nigeria, Switzerland, Spain and France were also among 10 other countries that engaged in industrial actions during the pandemic. Lack of adequate equipment to fight COVID-19, delay in salaries and lack of medical cover being shared grievances among these health workers, just like here in Kenya.
All county governments have provided comprehensive medical cover for their employees, including health care workers.
According to a response letter to the Senate Health Committee issued by the National Insurance Fund CEO, Dr. Peter Kamunyo, on 7th December, 8 counties did not have active NHIF cover. Marsabit, Tharaka Nithi, Kitui, Makueni, Nyandarua, Elgeyo Marakwet, Baringo and Bomet. And despite Nairobi County procuring services from a private insurer, the Nairobi Metropolitan Services delayed their payment and the insurer cancelled the contract in November.
And the only package that can cover COVID is the comprehensive group life, inclusive of the insurance that can cover COVID expenses.
The comprehensive life cover is only available to national government employees, and for that reason, NHIF indicated in the same letter that if at all county governments were to procure collectively this cover, then it will cost them a total of 5.3 billion shillings. If not, then the premiums will go higher.
We will not allow those other private companies which are being used by the governor to siphon money. So we trust National Health Insurance Fund. It has issues, yes, but despite the fact that it has those issues, we still have trust in NHIF.
So taking care of our welfare is serving us as Kenyans.
As it stands, the health workers indicate they are open to consultations, but threats and intimidation will not solve the already existing situation. Raquel Mugai, Citizen TV.